in terms of anxiety, Sam also had problems with word retrieval that was so common in dyslexic readers and were especially exacerbated by his anxiety. And so let's consider for the basis for such word retrieval problems, which are so commonly seen in individuals who are dyslexic. And we'll begin with identifying and naming an object, a two-step process. So let's first start with a typical reader. What does a typical reader usually do? So in this top portion of the figure, a typical reader uses his intact, higher order thinking abilities to develop a concept and identify the abstract semantic representation of the word that represents this concept. And for typical readers, the next step in this two-step process, using the word, is performed smoothly. So for instance, in this figure, for the typical reader would say bat, and it's broken down to at. But for the dyslexic reader, the first step, using his or her cognitive ability, is performed well. But the second step where one assesses the sounds making up the word and then smoothly uttering the word, is disrupted. And not only is it disrupted, it's made even worse by co-occurring anxiety. So with an individual with anxiety and dyslexia, it's almost cyclical, whereas the individual is anxious and the dyslexia and the anxiety almost feed off each other. So Sam had always, in terms of treating Sam's anxiety, Sam had always been very resistant to taking psychiatric meds, as many people often are, believing it was a sign of weakness and that he should be able to be, quote, strong and power his way through it, end quote. However, when his psychiatrist posed this question, Sam, if I told you had high blood pressure or diabetes, would you even think twice about starting those medications? Sam knew it was really the stigma of being on psychiatric medications that bothered him than the actual medication itself. And he agreed to give it a chance. And that's often, there's unfortunately such stigma with mental health and medications that's quite common. And then in looking at what are the medications, the arsenal, if you will, that are available for anxiety and that Sam had at his disposal, in general, the medications effective in treating anxiety and as well as ADHD generally work by acting on neurotransmitters, chemical messengers that either stimulate or inhibit nerve impulses in particular areas of the brain. And the core first-line medications employed include the SSRIs, which stands for the selective serotonin reuptake inhibitors, and they include medications like fluoxetine, Prozac, paroxetine, Paxil, sertraline, Zoloft. Other medications that are also commonly used are the serotonin and norepinephrine reuptake inhibitors, and those include venlafaxine or Effexor, and the norepinephrine dopamine reuptake inhibitors, that's like bupropion or Wellbutrin, and the alpha-2 adrenergic receptor antagonist, which is mirtazapine or Remeron. And it's important to know, and this was explained to Sam, that these medications are equally effective in treating anxiety. There have been no head-to-head long-term studies demonstrating superiority of one medication over another. So in selecting, if there is no superiority, in selecting an anxiety medication, it is important to consider the history, the family history, which is a history of a family member who has been effectively treated on the medication, other medications the patient's currently on to avoid any negative drug-drug interactions, and the possible side effects and how long the medication would stay in that person's system. And so Sam was placed on an SSRI, which was Zoloft. All SSRIs the onset can take up to 4 to 6 weeks to become effective and have similar side effects. And the most common of those side effects include gastrointestinal disturbances, which include diarrhea and nausea, and sexual side effects, which include anorgasmia and decreased libido. There's also potential weight gain and some sedation with these class of medications. And so another class of medications that are and were employed in the treatment of anxiety include the benzodiazepines. And the common benzodiazepines include diazepam, Valium, alprazolam, Xanax, clonazepam or Klonopin, and lorazepam or Ativan. And in addition to regarding these medications, the concerns about tolerance and dependence, side effects include drowsiness and potential cognitive impairment at higher doses. And so one of the advantages, though, of the benzodiazepines is, unlike the SSRIs or SNRIs, the onset is quite rapid. And so benzodiazepines are immediately effective, which is particularly helpful when individuals are having a panic attack. And so when Sam was hearing all this, the psychiatrist had discussed all this with Sam and explained another class of medications called the beta blockers, which were helpful in controlling the physical symptoms of anxiety, such as sweating, trembling, increased heart rate, and blushing, and giving a talk or taking a test. And the beta blockers symptoms are believed to be the result to help with the result of reducing the result of epinephrine release, which is inhibited by these beta blockers. And so these medications the beta blockers do not affect the cognitive aspects of anxiety and affect only the physical symptoms. And they're often used by musicians or folks that give talks a lot because it doesn't affect their cognitive ability, but really helps with the sweating and the trembling with their hands. And one of the more popular beta blockers is a medication called propranolol or Inderol. Its onset is immediate, and its potential side effects include decreased heart rate, weight gain, and depression. And so Sam was informed that these medications were only part, of the treatment for anxiety disorders, because and this is really important, an equally important treatment involves undergoing individual behavioral therapy, particularly CBT or cognitive behavioral therapy.